Good evening, everyone, and thank you for joining us again this week. My name is Victor Ramitzi, for those who are new and attending for the first time, and I am your host. Today we have Sarah Cohen, who will be presenting on resilience and being an independent consultant. So Sarah has an academic and a professional experience background in laboratory and operations and has worked in the industry for over 10 years. And she will be giving us a talk on being an independent consultant this week. So if you have any questions during Sarah's presentation, please send them through to the Q&A section and we'll try to get through as many as we can at the end. Sarah, over to you.
Thank you, and good evening, everyone. And thanks, Victor, for the opportunity to present. Um, Thank you for the introduction as well. Just to give a little bit of an overview of myself and my background, I initially trained as a medical technologist with a focus in microbiology. After that, I did a BTech laboratory management just to ensure that I had management experience, because as you get into a senior post, you want to have that experience, not only the technical knowledge. Then I transitioned into clinical trials and worked in clinical trials for approximately 17 years. So, from a laboratory aspect, doing the research, and then moving over into operations at a clinical trial site and working with a number of clinical trial sites in different provinces of South Africa. And then approximately 2 years ago, I decided to go independent because of restructuring at my current job at the time. So then I decided I would start. And I must say, for those starting a journey like this, you need to be resilient. And that's why I put it into the title as well. And I'll talk a little bit more about that. But during the past 2 years, I've really done many things, not only working with lab oversight, but also mentoring, assessing, and auditing, helping to compile different documents, training, coaching. And then I also train in GCLP, GCP, and research ethics as this relates to clinical trials. And also, some laboratory personnel need that training too. So I think it encompasses all clinical trial staff that need to be trained. Rieta, who I am familiar with as a colleague, also trains in GCP and research ethics. And she spoke a little bit in a previous presentation about the qualifications that you need. So even lab teams need to have that GCP, that GCLP training if they're going to work on clinical trials. And so breaking down resilience, I look at the acronym REAL and what it stands for. So the R stands for resilience. I think you need to be prepared for challenges. You do not get a salary at the end of every month as in a regular job. You need to be prepared to branch out, to do different things. And I think the E then stands for eager. You need to be eager to learn, not to stay fixed in what you know, but move and do different things, as I have tried to do in the last 2 years. You also need to set yourself some goals, I think, to achieve your end point, and decide at the beginning, if you are going to go out into the world as a consultant, what do you wish to achieve? What is your goal? And I knew my goal was to maybe teach the next generation, to transfer my skills and my knowledge and my experience to others. And that's why, for me, the mentoring and the coaching part has become so important. I love training. I've always loved training and sharing knowledge with others. And I think that's really been one of the goals that I've looked to achieve in the last 2 years. And then the L in real stands for learning. So never stop learning, look for opportunities. And I must say, during COVID-19, there are many, many opportunities to learn, many courses being offered, a lot of them for free. One course I would recommend, if you are working in COVID-19 or you're interested in it, then there's a good course offered by the African Society of Laboratory Medicine. They have regular webinars to teach people skills and knowledge. So I've joined that. And also there's an academy called the VIARES Academy, VIARES, that does a program preparing people who want to become CTAs or CRAs. So it's an online training. I've just completed it. I'm about to write the exam. I would recommend anyone who's interested in going into the industry do this. I mean, I heard Rieta say that it's important to do the GCP training. That's not as expensive. It is a worthwhile exercise to do GCP training, GCLP if you can. But a CRA training often is thousands of rands. A lot of people can't afford to do it. So look at options online, because at the moment, really, there are many trainings available to people who are starting new in clinical trials, want to learn more, want to have more knowledge, not only technically, but also softer skills, because I think working as a consultant, you need some soft skills. You need how to ability to deal with different stakeholders. You also need to have good business writing skills. You need to be able to interact with people in different environments. A lot of the work when you work as a consultant is contract work. Therefore, you will be interacting with people quite intensively, but on a short-term basis. So that's important to build those soft skills as well. And it's all linked to emotional intelligence, how one interacts with different kinds of people, scientists maybe staff at a clinical trial site, research staff, administrative staff. So it's important to know that. So some key messages are as follows. The power is in you, not only to bounce back, that is linked to being resilient, but to surpass heights you never thought you could achieve before. So there are 5 steps which I consider really important to reaching that goal. So start by trying. I think it's very important. If you're doing something new, try. I believe that one must always try. Not think of failure as the goal, but think of the exercise as a learning exercise. So when you're doing something new, particularly if you decide to go out as a consultant, I decided in the 2 years I would take anything that was offered to me that I could help with. Writing manuscripts, training people. I've got a number of students that I've been monitoring who are doing honors, masters, and PhD programs, and have come to me and said, I've got a supervisor already, but my supervisor is not there for me. I need help editing. Will you read this? Will you tell me whether my research question works? So that sort of things. From a clinical trial perspective, I've done assessments. So those are pre-site assessments where I look at a laboratory specifically and sometimes a clinical trial site to do a feasibility, to see are the sites or are the labs prepared for doing clinical trial work. And so that is important work as well. The other thing that I have felt is important is to coach and mentor people who are new to laboratory work, who are new to clinical trials, who need that extra support. And so I've been contacted just by word of mouth by various people. So I think you need to be ready for that, to assist others and to share your skills. The other thing, if you're working as a consultant, and I do have a home office, is to know how to deal with distractions as well. Because often working on your own, not in a set environment, you are open to distractions. You need to build up that confidence and say to yourself, I am going to do the 5-hour day or the 8-hour day. I'm not going to be distracted. I'm going to set goals and plan my day and decide what I'm going to do every day so that you work in a structured format. I think it's very important to plan. Sometimes as a consultant, you may be working on multiple projects. So it's very important to allocate enough time to every project that you do. The other thing is get specific. Decide at the outset, what are you going to focus on? What is your area of focus? For me, it is still laboratory with a firm focus as well on clinical trials. So I have assisted in developing informed consents for studies, but I also look at laboratory specific documents as well when I'm requested to do that. So decide what you're going to focus on. What are your good areas? What are your strong areas where you have experience and your skills and you can share? And then it's a process mindset as well. Set yourself a process where you have a beginning, a middle, and an end. I think if you work as a consultant or if you work on a contract, tell people up front, I am able to deliver this task and this is the timeline. You need to set yourself some deadlines, because if you don't, you can land up in a sticky situation and you won't be able to deliver on time. And working independently, I think you need to tell the person or the stakeholder that you're going to be providing the service to, or even if you see them as a customer, you're providing a service to a customer. Be prepared to set some timelines and some ground rules and deliver on time. If you aren't able to do so, I think you need to explain yourself. You need to give a rationale why you're late on delivering on a particular task. So that's very important. I think be brave and be willing always to reframe. So if you don't have the skills, as I mentioned before, you can learn, you can ask others, you can ask for help. So I think those are critical elements to look at. If you're starting out as a consultant as well, as I mentioned, it helps to have some sort of a remote office. Obviously, you would need a laptop, you would need a cell phone with some airtime. Wi-Fi helps. Um, if you're going to work on your own and you're going to travel to clients, remember to keep a logbook of all your mileage, because if you're going to submit a tax return, there are certain things that you need to document, like your mileage, any things that you need to set up your remote office as well, like a printer, a scanner, home office space. All of those can be submitted as part of a tax return when you're an independent consultant. My recommendation would be for submitting tax as an independent consultant or contractor, it's important to get maybe a financial advisor or someone to help you with that, so you're on the right path from the beginning. And then you can ask yourself another question, which I'd like to address, is how do you stay motivated as a consultant? What do you do? So take it one day at a time. This is new. If you've been in a full-time permanent job, working as a consultant is new, and you need to take it one day at a time. Surround yourself with positivity. Say in your mind, I can do this. I know it's really difficult during these times of COVID-19 to stay positive. There's a lot of negativity out there. There's a lot of social media platforms that are giving us a lot of negativity, a lot of negative information. So I think stay positive. I think from a clinical trial perspective, we do know that there have been issues at the clinical trial sites whereby studies have been stopped because of COVID-19. The sites cannot see participants at the moment. So it is a bit of a challenge, but we have to get around that. We have to sometimes do remote monitoring. We need to do follow-up of participants remotely or by phone if you're working at a clinical trial site. So things have changed. So we need to be adaptive to the change, and we need to have a positive mindset when we're doing that. If you're a consultant as well, create a vision or a brand so that people know you, so that they learn to trust you and know what you can offer. Also make some SMART goals. So SMART, SMART goals. So your goals need to be defined. They need to be workable, manageable. And then remember to reward yourself. So if you're working from home, for example, you have your structured day, let's say it's a 5-hour day, an 8-hour day, whatever. Give yourself a break as well. Don't work yourself to the death. I've noticed with some consultants, when they start working for themselves, they work extended hours, 24/7. This is not a good way to go. I mean, one is trying to be lucrative in some senses, but one also needs to stay healthy in the times of COVID-19. One needs to look after self as well. Prioritize your work goals, but prioritize as well your own health. And then believe in yourself. I think it's important to believe in oneself and realize that one can actually do anything. One can always learn, one can achieve, but you need to believe in yourself as well. You need to recognize your progress as well as your limitations. So if you feel the tasks are onerous, you don't have enough experience in what you've decided to tackle, ask others for support or go online. We're really lucky that there are a lot of possibilities on Google to research and YouTube to get guidance if you're stuck, if you need more information as well. Always be kind to yourself. And most of all, I think it's important not to compare yourself to others because everyone does things differently. People have different strengths and weaknesses. So people can offer different things. So you need to look at it with a clear mindset and a vision of what you want to offer, what you have to give others, the skill set and the training and the abilities that you want to share as well. And there's one quote that has always stayed with me, and that is Winston Churchill, who made a great remark that success is the ability to go from one failure to another with no loss of enthusiasm. So I think it's always important to remain enthusiastic. I think clinical trial field is a very exciting field. Research is an exciting field. The healthcare field as a whole is very exciting at the moment. I know we're dealing with challenges, but there's so much to learn, so much to achieve, so much we can do in the South African as well as in the African context. And I think there are also a lot of webinars on at the moment where we are trying to collaborate, not only with the US and with Europe, but within our own continent. And there's just so much that we can do, we can develop, we can innovate. So I think I'd like to stop there and take any questions if anyone has anything they'd like to ask at this point.
Thank you so much, Sarah, for the very great presentation. And I think most of science graduates, when you're looking for a job in clinical trials, you're not thinking lab-based work if there's an opportunity to work in a lab and not necessarily also be an independent consultant. So thank you for enlightening us and sharing insights into that. So if you have questions, please use the Q&A function and Sarah will be able to see your questions and then she will respond uh, to your question. But before you start with the questions there, Sarah, I have a question for you.
Sure.
Where does one start if they want to be a consultant and how tough is it to get into the market?
Well, it's become even tougher now with COVID-19. I mean, 2 years ago when I started, it was tough, but I think it's become tougher now. A lot of people are trying to consult and offer different skill set because of the, retrenchments all around us at the moment. But it is tough. But I think a lot of it goes by word of mouth as well. And being in the industry, if you're already in the industry, I think one needs to network a lot. I would recommend being on LinkedIn. You need a strong profile on LinkedIn. You need a good CV. And myself, when there was restructuring at my previous work, I thought to myself, well, let me see what I can find out there. And I literally um, re-examined my CV and I thought, I don't really know how to do this. So go to someone professional. I'm not sure if I'm allowed to name someone who helped me with my CV. Victor, is that allowed? Yeah.
Yeah, sure, no problem.
Okay, so I went to a company called the Appointment Firm and I worked with a lady called Andrea who was really very good, helped me with my CV and she did my LinkedIn profile as well. If people want to create their own website, is amenable to doing that. She charges very reasonable rates because I did a bit of research. There are a lot of charlatans out there who promise you that they'll do a good CV, a good LinkedIn profile, and basically they take your money and don't do the job. But she was really good and she liaised with me on a one-on-one basis till we felt we got everything right. So I think it's important, if you're going to be a consultant, get yourself a good CV, get yourself a good LinkedIn profile. I'm not on Twitter. Some people go onto Twitter and use that as a social media platform. Again, if you want to create your brand, I created some business cards. I created a logo, so that goes onto my invoicing as well. So that's something useful to put together as well if you're going to create a whole package for yourself as a consultant. I think networking really important. I mean, whatever meeting I go to, I think it's important to always get business cards from others, speak to as many people as you can. And at the moment, as I mentioned before, there are just so many webinars that you can join, so many opportunities to train and network online. And I think take that opportunity as well. I will send you the details, Victor, about the CRA training, the academic program. So how it works is you do an application, they assess it, and if they feel that you fit their skill set that they require, then they offer you an opportunity to join the academy. What it entails is a 3-month commitment, basically, to do the training. It's all done online. You have to attend webinars, you do quizzes, you do assignments. There are webinars that you attend, live webinars. I think 3 sessions that I had to do, and then you write an exam, and then you get your certificate, yeah, to show that you've got some CRA training. I think it's really difficult these days. There are not a lot of CRA trainings out there. Some CRAs are trained on the job. So it depends. If you can get into a company and get a position and they're willing to train you, that's great. There are not a lot of companies at the moment are willing to take people with no experience. Yeah, so it is challenging. Um, yeah.
All right, thank you for that, Sarah. So this answers Romu's question about online courses about CTA training. So Sarah will give me the information, and when I share the link for this recording on my LinkedIn profile, you can see the information. Or you can send me an email. My email address
Oh,
is on the poster. Yes,
yeah.
sir?
I will send you the details for the training. Someone has asked how much is the course. There's no cost involved. If you get accepted, there's no cost involved on the course. Yeah.
All right. Um, yeah, so just to add on another networking platform, try to get onto Sakra. This year there hasn't been any meetings because of the lockdown. So, but you can subscribe to their newsletters, go to their website, and then subscribe to their newsletters. And if you do get a chance to attend their meetings, it is a really great place to network with people in the industry and meet people. And just to echo Sarah's words, LinkedIn is very powerful. Do not take it for granted. So yes, Sarah, there's another question. Can you see it? From Mohadi Mulebatsan.
How do you Yeah, how do you approach potential clients? Just to mention something about SACRA, thanks for that, Victor. I am a member of SACRA, so that's important. We have had one meeting remotely this year, which was an excellent meeting. I will send you the link to the YouTube video because it is available and you can share it then for the attendees on this call. We had Prof. Slim Karim talking about the COVID-19 epidemic, and then we had a SACRA committee member give him some guidance about clinical trial sites, how the clinical trials are focusing at the different sites at the moment, what are the requirements from SAPRA, because SAPRA sent out some guidelines, the South African regulator, about remote monitoring as well as remote follow-up of participants, etc. So I can share that with you, Victor, if you want to share it with the attendees. I'll send it to you via email as well.
Yes, thanks, absolutely.
Okay. All right. How do you approach potential clients? So I always look at various platforms. I Google, I look at LinkedIn, sometimes the opportunities that are posted on various platforms. And then obviously I would send my CV through and say, look, I'm interested in this position. Do you need a contract person to help you, and then yeah, that's the way I get the jobs. A lot of it is by word of mouth, though. With the students that I've had one student. I started off at a particular university, and one student contacted me. They heard I was, helping with the various theses, and then through that, another student contacted me. So it was sort of by word of mouth, really. I think that you need that network of people that you speak to, and once you get something, normally it snowballs. You get work through other people, but as well, looking on various platforms, on LinkedIn, that is a recommendation. Looking at various, like PNet, you can look for jobs. You just Google, and you set yourself up that you get newsletters as well. You get newsletters on a weekly basis with all the openings, whether part-time or full-time. You can actually Google, and it allows you to put in a request of what you want to get. You can actually drill it down and say, okay, I want to get notifications on healthcare positions that are contract or part-time or whatever, so that you get weekly updates from various providers. Recruitment agencies, I have signed up with a few. I've given them my CV, and they keep it on record in case anything turns up, and then they contact me. Yeah, so those are some of the avenues I have used. Obviously applying to open positions as well. You can do that, but remember, have a good cover letter and a strong CV, because recruiters get thousands of applications, and most of them head straight for the bin. One of my friends is a recruiter. She says we need a strong cover letter and a strong CV, and don't use the same cover letter for every position. Don't recycle them. Really make it specific for the role that you're applying for as well. Very important.
Okay. Thank you, Sarah. Maybe we'll have a
Okay.
chat about how you can put me in touch with the recruiter, and maybe we can have another discussion on CV and cover letter writing for all the attendees.
Yeah, okay. I'll send you a contact name of somebody, and maybe you can do, a presentation with them. I'm sure there's someone who can assist with that. Yeah.
Absolutely.
Um, yeah.
All right. So
Happy to
then,
do that.
all right. Right. So I see there's another question from Mulebatsane. Just if you can respond to that.
Is it possible to work full time and consult on the side? I think you can. You just, as I say, you have to plan and juggle, but it all depends when they would want you to do the work. If it's remote work and you could do it after hours, then I suppose you could work part-time and have a full-time job as well, consult on the side. It all depends what you're going to offer. I think one could, yeah. Mm.
Right. And there's a question from Rieta.
Oh,
Rather a comment. So Rieta says that you cannot work full time and
you
consult.
can work probably.
Your full time agreement will prevent that. So I think what Rieta is saying, Mohari, is that you cannot work full time and consult because your full time agreement, the contract that you sign at work, you just have to have a look at that.
Mm.
Unless I suppose you can discuss it with them if they're open for that. I'm not sure if um, companies would be open to that, or because conflict of interest and the industry is very small. So yeah.
Mm. Yeah, if it's a conflict of interest, definitely not. So if you're working, say, full time in a laboratory, you won't be able to go work night shift in another laboratory. I mean, you'd have to inform your employer if you were moonlighting. That's not something that I would recommend at all. Yeah, some people have tried that. Don't do it. Yeah, it's not the way to go. Yeah, but if you're going to work full time, say in a laboratory, and in your own time, maybe you're going to do some editing. I don't see that being as a conflict of interest. It all depends which field you aim to consult in and where your full-time work is. Yeah, I guess your responsibility should be to your full-time work.
Right. I see Rieta did say and confirm that pharma companies will not allow that. So yeah.
That, yeah. Okay.
Yeah.
Yep.
So
Yep.
we
Yep.
out of time, and I would like to thank each and every one of you that has taken their time out of their leisure time to join us. Thank you very much, and thank you, Sarah, for coming and sharing your experience and knowledge with us. I would also like to take this time to thank Chanel and Rieta on behalf of FCRN and Be Compliant for sponsoring these webinars and making them really possible. So if there's anybody that would like to present, or if you would like to sponsor one of the webinars, please get in touch with me. My contacts are on the poster that I share on LinkedIn. You can also send me a message on LinkedIn and we can discuss this further. So thank you, everyone, and have a good evening. Cheers.
Thank you.
Bye.
Bye.